My name is K.C. Balaji. I'm professor and chair of urology at UF Health Jacksonville. UF Health Jacksonville is one of the major academic medical centers in the region. We care for a variety of patients with complex diseases. A majority of patients who come to us because of urological cancers, namely kidney, bladder, prostate, and testicular cancers. When patients need cancer care and they want to come to UF Health Urology, we make certain promises, and it's a psychological contract we live by. First is we are accessible. In other words, when patients call us for an appointment, we don't tell them when the next appointment is. We ask them when they are available, and we'll see them when they're available. If for some reason we don't have the right specialist at that time, one of our team members will see the patient and eventually get them to the right specialist. Because at UF Health Jacksonville, we understand how anxiety-provoking a diagnosis of cancer or even a thought of having cancer could be to patients and families. So that's where our relationship starts. Once we see the patient, we take time to explain what the diagnosis is and then the various treatment options available. Because we are an academic medical center, we practice what we call evidence-based medicine. We make recommendations based on the latest medical evidence that's available, and we offer all the options to the patients. In fact, a lot of times when we discuss these options, patients generally need some more time to think it over. We in fact recommend some highly reliable websites for them to do their own research, and they tend to come back within a couple of weeks with more questions, and we try and meet them as many times as the patient and family want to explain to them their various options. Once the patient and the family decide what would be their best option, then we go ahead with a plan to offer the treatment. And this treatment is highly coordinated and offered as soon as possible. This could be complex robotic surgery. We do that over here. Or this could be an immunotherapy or chemotherapy that needs to be given. We do it over here. Or this could be some novel drug treatment that has been just approved for use in this disease state. We are able to offer them here. So when cancer patients come to UF Health Jacksonville, what they can expect is the highest level of professional care that is very easily accessible, and we will communicate in the language and to the level the patients understand, because we believe if we empower our patients with the fullest information, they will be able to make the best decision for themselves and their families.